Hello and welcome back. In Chapter 7, we're discussing effective intake interviewing skills. So, an intake interview is the face-to-face interaction between you and your client. It's probably the most important interaction you're going to have because it's going to be that lasting impression that the client has of you. But it's also the session where you're going to collect data and information on the client to help paint that clinical picture for the resources and the assistance and support you're going to provide as a case manager. So so the purpose is to gather information, establish rapport, and set the foundation for that relationship that you're going to have. Set that foundation for how you want services to go and how to best treat and utilize case management for the client. So effective interviewing skills are very important. It helps you get accurate information, and it helps again start to establish that rapport that's needed for a good helper client relationship. So the attitudes and characteristics of the interviewer. Again, we want to be warm. We want to be accepting. We want to be genuine. And when I mean be genuine, being your authentic self as a professional. You want to be able to accept the client, not judge the client. Provide a level of warmth that's going to seem inviting to the client, creating a connection with the client. You need to be aware of your personal biases and strive for cultural sensitivity. And again, it's really important for all treatment providers to know their belief systems, to know what they believe, know how they feel about certain topics, know how they feel about certain populations or whatnot. Because if you don't know, you can have implicit reactions. Automatic mental associations are responses towards certain people or cultures or whatnot if you're not aware of those biases. If you're aware of those biases, you can work to, again, remain in that neutral stance to provide effective care. But if you're unaware of those biases, it can definitely hamper and create some barriers in that therapeutic relationship. So we also want to maintain professionalism and be empathetic and approachable. Remember, empathy is that ability to understand how a client feels, not to understand or to say that you know what they went through. That can be very, very invalidating to say that you know what someone went through, right? Because we all respond to different situations differently, right? So it's really important for us to respond to situations using empathy because empathy drives connection. It's the ability to understand again how someone feels. So, communication skills that we all want to have as case managers, you want to be effective listening. I have active listening skills. You want to concentrate on the client, understand and respond. And you want to show the client that you understand what they're saying. You hear what they're saying, and you're actively listening to their statements because a lot of times they're here in our setting because they don't feel heard. They don't feel as if people are listening to them. They don't feel as if there's a connection. Questioning. We want to use open-ended questionings and encourage detailed responses. Clarification. We want to seek to understand ambiguous or unclear statements. And summarizations. We want to periodically summarize information to ensure understanding of what the client is saying. And also, when you summarize or paraphrase a statement that a client is saying, the client can provide clarity on it if what you paraphrase or summarize isn't accurate to what they or how they are feeling. So again, we want to continuously paraphrase and summarize what they're saying to gain clarity on what has been said. So, interviewing skills. The solar model. This is how we want you to create an open stance with the clients and make the client feel as if you're present there with them. So solar is an acronym where the S stands for you want to sit squarely facing the client. You want to adopt an open posture, meaning you're not closed off or have your arms crossed or legs crossed or whatnot. You want to have an open posture. You want to slightly lean in towards the client. You want to maintain appropriate eye contact, and you want to remain relaxed and put the client at ease, right? So that solar stance lets the client know that you're not uncomfortable, that you're open to what they're saying, and you yourself feels adequately about the therapeutic relationship. So some interviewing pitfalls to avoid. So I talked to you guys about empathy. Empathy drives connection. Sympathy drives disconnection. Sympathy is trying to fix things, trying to put a silver lining on things, right? So you want to avoid premature problem solving. Avoid jump to solutions before fully understanding the issue. Giving advice. Again, encourage clients to explore their own options rather than you give them direct advice because, again, you want to help the client help themselves. So you want the client to come up with their own advice, right? So you want to create avenues for the client to problem solve and to encourage and explore their own options, right? So you want to use over reliance on closed-ended questions, right? It can limit the client's responses and stop the rapport building, right? So you want to ask more open-ended questions than you do closed-ended questions, right? And then you want to rush into fill silence. Silence is not always a bad thing, right? Silence can be a good thing. Give you time to think. It can actually capture moments that the client has said something that's very abstract or something that's very impactful, right? And there's sometimes there's some moments that the words can't express the moment that's in hand, right? So you want to make sure that you don't try to fill silence, because a lot of times silence can be productive, but it can be unproductive if silence makes us uncomfortable and causes us to want to respond too quickly, right? So cultural sensitivity in interviews. Again, you have to respect everybody as a unique individual. You want that client to feel as if they're being looked at as them unique selves and not being put in a box, right? And you want to be aware how cultural backgrounds can influence the client's perception about you, the interaction, and services themselves. Is there any stigma on these services that the client may have? So you need to be aware of how the client feels about the situation and about the helper or provider client relationship. And you want to use culturally appropriate language. You need to be mindful of the nonverbal cues. So again, you want to use language the client understands. You want to make sure that the client understands um, what you're communicating to them, and you also want to make sure you be mindful of their nonverbal cues. Are they restless? Are they resistant? Are they, when they talk about certain issues, is there a change in their expressions, a change in their tone, a change in their affect, a change in the way they present, a change in their emotions, right? So you want to be very mindful of those. So finally, we want to make sure that in an effective interview, again, we start to build that rapport. We want to begin to collect information on the client. We want to establish that clinical picture of the client so we can know exactly what they need for services. We want the client to discuss things and put some feet and some leg work into the work that's going to be done. We don't want them to come in thinking that we're going to do all the work. But again, we're there to help them help themselves and attach them to resources that can benefit them in their external lives and in treatment. And we want to also make sure that we utilize the correct interviewing skills to create that environment where the client feels free to express. So active listening, appropriate questioning, and cultural sensitivity are huge roles with in doing that. And again, we want to avoid some of those common pitfalls. We don't want to prematurely try to fix situations. That's sympathy. Again, empathy drives connection, sympathy drives disconnection. We want to make sure that we're aware of the core issue before we start trying to problem solve. We don't want to give advice. We want the client to come up with their own solutions. And again, we want to ensure that we're creating an environment where the clients feel free to express themselves and they are putting leg work in and feet in to their care. And we're doing this as a partnership.